Well, welcome everybody. Thank you for joining us on a Monday night. Crowd is this is so important to have everybody here with us tonight. We are going to be talking about radical health tech innovation, which I don't know if anyone else has been to a Disruptive Technologists event. Raise your hands if you have been. Okay, wow. So a good amount of people. This is a much different topic because we're talking about health and things that relate to our mind, body, and soul. And that is so important because normally when people talk about technology and artificial intelligence, most people, I know myself included, are saying, what is that and how does that relate to me as a person? But everyone here, how many people have been to the doctor's office? I went to the dentist today, and I came back just for this. So there's so many advancements in medicine and healthcare and especially data. That's going to be a really big hot topic tonight, things that we need to know and different advancements going on. So this is going to be a great event. But first, we need to thank some very important people that make this all possible, starting with Microsoft. This is where we are today. And Microsoft's mission is to empower every person and organization on the planet to achieve more. More importantly, we have a Microsoft reactor rep, Sept DiMaglio over here. Thank you, Sept. So Sept is actually going to be doing some really fun giveaways in just a second. But a little bit about the reactor space. Microsoft reactors are neighborhood campuses where developer and startup communities meet, learn, and connect, combining training on the latest technology, community meetups, and events with leaders in the industry. Reactors create an exclusive community for interaction and inspiration. You can follow them at MSFT Reactor on Twitter to learn more. Okay, and now Sept, the man of the hour, and our disruptive Microsoft host, he is going to be picking 6 winners out of this. Yeah, you didn't know 6?
I knew it.
Oh, okay.
So we have a few things that we're giving away. As Lauren said, some oversized t-shirts. You can get really creative in cinching, tying, cutting. Fall is coming. Maybe make like a shawl. And we also have mugs. So I'm going to call 6 names, and then the 6 winners can come meet me in the corner and duke it out on who gets what. That's how I'm going to do it. Do you want to shake?
I will.
Okay, and I'll look away. Okay. I'll try to get an equal mix of business cards and non-business cards. So the first one is Paula Lou.
Hey,
Woo! So you can just wait. I'm going to go over there. Okay. I gotta get another one quickly. The next is, Dijon Kovacevic. Am I saying it wrong? Yeah, did I mangle it? Congrats. I'll do my best. Santos Gonzalez. Are we here? Are we here?
Over there.
Oh, awesome. Maybe I'll get another non-business card. Jana, I can't read the rest. Ozensky? Osne?
All right. Congratulations.
Yes.
How many was that?
There's 4.
4.
2 more. Bob Fogel? Fugel? Fogel? Fogel. Yes.
There you go.
I like to be inclusive of my pronunciations. Alex English, that's an easy one to say. Awesome, loved that. Is that 6? That's 6. We did it.
You guys can, yeah, you can find Sept. Now you know what he looks like and who he is. He's got your prizes. Okay. So we also have McCarter in English, LLP Law McCarter in English, to thank. McCarter and English is a firm of approximately 400 lawyers with offices in Boston, Hartford, Stamford, New York, Newark, East Brunswick, Philadelphia, Wilmington, and Washington, D.C. In continuous business for more than 170 years, we are among the oldest and largest law firms in America. Its industries include, well, there's a lot of industries, but we'd like to thank them. Yeah, so we can clap it up for that. So I want to get to you, our fabulous panelists. So we are also thanking Visiotag, and they are going to be formerly known as Visiotag. New name is Zeotag. If you've seen the camera in back of us, Steve and Jeff do a fabulous job documenting the panelists and the discussions. If you ever want to see somebody you missed, you can go to the Disruptive Technologists website. You can look them up on YouTube, and you can find all of these interviews individually or all together if you missed anything or if you wanted to share someone really awesome. So I'll tell you a little bit about Visiotag. As a partner, they've been a partner with Disruptive Technologists. You can meet the founders, Jeff, Paul, and Steve Durham, the back of the room, as we just pointed out. Visiotag, now Visiotag, provides innovative technologies that greatly extend the intelligence, functionality, and monetization options of all forms of web, video, and audio. Its flagship product, the Visiotag Media Publishing Platform, is a robust host-based framework that uses sophisticated metadata to make online media content easily searched, navigated, shared, and ultimately consumed. And our other sponsor to thank is Hint fruit-infused water that you've all been enjoying in the back of the room. Hint contains no sugar, diet sweeteners, calories, or preservatives. Their water brands are non-GMO certified and Whole30 approved. They are vegan and contain no MSG, nuts, soy, or gluten. Well, that's good to know. Their bottles have always been BPA-free, and they are continuously improving their bottling to reduce the amount of plastic and other non-renewable resources. Their goal for, this is 2018, but I'm sure 2019 as well, is to use 40% less plastic per bottle than our original 16-ounce bottle. So thank you, Hint. And sponsoring our next event. So this is an exciting opportunity that I am excited, well, so exciting that I said it twice. If you know anyone that wants to be a sponsor for Disruptive Technologists, we're currently seeking members, brands, companies to come on board and join us. These events, as you can see, they pack a house. You meet the best and the brightest in AI and tech, and it would be really lovely to have more people involved. So you can obviously talk to Lauren afterwards, but we would like to extend this invite to you to be our next sponsor. So yes, and if you'd like to sponsor our next event in December, that is when the next DT event is going to be. Smart Cities, Smart Communities will be featuring New York City's next mayor, Eric Adams. Please see any one of our Disruptive Technologist teams, including me. And lastly, we would like to thank our Disruptive Techies friend, Dana Stevens, for the wine. Thank you. Okay, on with the show. So I'd like to introduce our moderator for this evening, Oliver Christie, who's sitting here looking dapper as ever. And Oliver, he is the artificial intelligence consultant and futurist. So that is the most impressive title I've ever heard of, and I am very excited to hear you curate this panel of excellent AI tech panelists. All right, everybody, give it up for Oliver.
So, thank you so much for coming out tonight. Firstly, a quick health notice. My voice is going. So, if it fails in the night, I will move to semaphore, and we'll get it through it somehow. But if my voice does go, just put your hand up at the back and shout something, and we'll work it out. So, thank you, and welcome to Disruptive Technologists. We've got a very interesting panel tonight on healthcare and wellness, where we are now and where we're going to be in the future. So we're going to be tackling three big questions. It's really, now the interesting thing is the panel doesn't know the questions ahead of time, so they haven't been prepared. But this is the layout for tonight, three big questions. Straight afterwards, we'll have Q&A, and I'll ask that the question is in the form of a question. So, not too long. Let's get to the point. And then afterwards, we're doing something different. We have a fireside chat here. So the panel here will be swapped out with 4 fantastic speakers, and Bruce is going to be leading that. So do stick around afterwards. And then at the evening, we're going to go over the road for drinks. So you'll be able to talk to some of the panelists afterwards as well. Before we do this, a disclaimer. And this wasn't written by MacArthur in English, I'll let you know. This is so we can have an open and honest conversation. So we can say the sort of things which we all think without pointing and saying, you're not allowed to say that. So I just ask that you're nice with your comments, and if you tweet and everything else, that you think about the context. So without further ado, our panel. On my left is Michael Frank from Pfizer. He is the Director of R&D Drug Strategy. And tonight we'll be talking about the role of AI for worldwide trials. Quick question. Can people get on Wi-Fi? We good? We happy? Yes, people are good. Fantastic. So yes, Pfizer will be talking about drug discovery, what's coming next. To his left is Paul Sohmer, the CEO of SRI International. So it covers medical devices, clinical and diagnostic. And he is, thank you. Thank you, Bruce. We're trying to work out, beforehand, we're trying to work out who the panelists have saved the most number of lives. And who's going to save the next million lives. And we've got a bit of a toss-up. So we've got Pfizer, obviously, who's done a hell of a lot, and more things are coming. But Paul extended the lifespan of blood. So we're very possibly alive because of Paul. So thank you, Paul.
You're welcome.
So, turning to something slightly different, and we did ask if you could bring in a sponsored bong, but he said no. So we have Guillermo from MacArthur in English. He leads the firm's cannabis practice. Thank you, Bruce. It's been a long day. So we're going to talk about innovation. We're going to talk about farm to table. And I thought you'd like that. And we'll be talking about medical and other uses. Other being pretty wide. To his left is Luigi Pesce, or rather Dr. Luigi Pesce. He's a neuroscientist, and he studies brain rehabilitation and electrophysiology. And we are very pleased to have him all the way from Venezuela. And last and certainly not least is Marlin Jenkins, the CEO of Neture. And he is using broadband. Thank you, Bruce. And one more. There we go. I can't blame the clicker this time. He's bringing broadband to underserved communities, especially in the US. So we're going to be talking about the impact for health and wellness and why the digital divide is quite so strong at the moment. So without further ado, that's me, but you know me already. So the first big question. What is the panel's motivation for doing what they do? I mean, for each of the panelists, what is it you do? Why do you do it? Why do you care about what you do? Because there's easier things you could do. Michael.
Okay, I'll start. So I'm in healthcare. I think Pfizer, like a lot of pharmaceutical companies, is filled with a lot of people who wanted to become doctors but couldn't pass the test. So we do what we can, but I'm only partially joking. I mean, the population within a big pharmaceutical company is almost all some type of scientist, or at least had an interest in science and healthcare and how they can work with patients even from a remote level where you're thinking about how to apply science to patients. So I think at a very distant level, I think what motivates me at Pfizer and what motivates a lot of people within the company is just to help people to see the rates of cancer deaths go down, to see people from rare diseases not suffer as much as they currently do. So I think that's pretty much what keeps me going in that space.
Do you have an issue you're most passionate about? The thing which either is personally affected you or the thing which you really want to solve?
Besides like male pattern baldness, which is one thing
No
I'm
comment.
worried about, but we don't actually have a drug for that, us personally. I think, I guess I have maybe one more year left. I think probably cancer. I mean, cancer by far is the scariest thing. I have 2 kids, and I see on TV any parent whose kids have cancer, and it's just the most horrible thing. Obviously, no kid deserves cancer. No adult deserves cancer, but certainly no kid deserves cancer, and the family doesn't deserve that either. And as long as it's still an unmet need in some of the more rare types of cancer, I think that's where I think we should be really focusing our money.
Fantastic. Paul, how did you get into the space? And you've done quite a few different things.
Yeah. So first of all, I'm not the CEO of SRI. So I'm an advisor.
Bad information, apologies.
That's okay, no problem. I'm flattered.
You've just been promoted. You're just a little closer.
Okay. So I'm very flattered, but I'm not the CEO. I'm an advisor. I'm a physician by training.
Just speak closer.
Is it close enough? Can you hear me now?
Just gonna tilt it.
How about like that?
The other way.
This way. Okay. So I'm a physician by training and by education. And I became, what really has motivated me has been saving lives. And it has been directed at solving clinical problems. And I just can't keep myself away from various sorts of clinical problems.
How early were you when you thought, this is what I want to do?
To solve problems like this? Well, I'll tell you exactly when it was. So after I finished my training, I trained here at Mount Sinai. I took a position, an unusual position for somebody who was a clinical pathologist, which was I ran the lab at the shock trauma unit in Baltimore. And this little unit, which at the time was the largest trauma center in the US, but it was only like 35 beds. But on any given Friday night or weekend night, it could consume the entire blood supply of the state of Maryland. And the Baltimore-Washington corridor was basically, a place for really significant injuries. And the kinds of injuries we saw were so serious that gunshot wounds weren't serious enough for us. So they went to Hopkins, so they went to the University of Maryland. So I ended up, I guess because I was the only guy who wasn't a surgeon, being the person trying to take care of the bleeding problems in these patients. And so this experience had a tremendous impact on my entire career, because one is, in managing these patients with bleeding disorders, we were always trying to identify the biomarker that somehow was addressing the underlying cause that we could treat directly. The second was, we didn't have blood. We kept running out of blood. So we began doing things like taking blood from the abdominal cavity and giving it back. This was sort of the early days of doing autotransfusion, when I was basically approached by the Army, who obviously had a similar interest in this whole problem. So at the time, the lifespan of liquid stored blood was 21 days. For the military, this was a significant problem. This was just after the Vietnam War. That the blood was collected here in the US, went to Travis Air Force Base, then went to Southeast Asia, and about 50% was outdated by the time it arrived. So this is a big issue. But even in the civilian population, this was a huge issue. It was about a 10 to 15% outdate rate. So it was one of those things where they put together a group of us, young, best and brightest people, brought us out to San Francisco, and we worked on this problem. And we extended the shelf life to 42 days. Took it through the FDA. It was the most incredible 2 years of my life. And once you've done that, it's really hard to go back to being a country pathologist,
You can't go back to the office job.
That's
after
exactly
that.
right. So
Yeah.
that's sort of what stimulated. And then the other track was the biomarker track, which I followed for my entire career since.
We'll come back to that in a
Yeah.
second. Guillermo, so we're going to turn left. How to phrase this? How did you first become interested in drugs?
I was far too young, and I've yet to recover.
Yeah. No, I'll rephrase that. At what point were you interested in the changing landscape, the medical application, this practice?
Sure, yeah. So I've always been interested in sort of law or medicine. First generation, come from an immigrant family, so it was either law or medicine. I wasn't so good at math, so I chose law. But I really did always enjoy sort of healthcare and health concerns. Everybody has the ailing uncle, the sick grandma, and those issues sort of always fascinated me. So when I went to law school, I sort of decided at some point I needed to move sort of closer to health within law. So I did a federal clerkship in the U.S. District Court of New Jersey, New Jersey being the medicine chest of the world. About 70% of the civil docket in the district court is pharmaceutically driven fights. Most of them are Hatch-Waxman lawsuits, which essentially is a brand drug trying to prevent a generic drug from coming onto the market within a 30-month period, which is near the expiration of that drug. So I was a law clerk for 2 years, sort of seeing the volley that went on in court. I was truly fascinated by it. Decided between brands and generic to go to the side that was going to pay me more money after the clerkship. So I went and became a brand side Hatch-Waxman litigator. My largest client was Pfizer. And then I got pretty tired of that rather quickly.
But not because it was Pfizer.
Not because it was Pfizer. It's a
Thank you.
phenomenal company. I think the generics, frankly, in today, we talked about this briefly earlier. I mean, the Tevas of the world, I mean, it's a brand wearing a different color suit, frankly, at this point. So I decided that I wanted to go sort of into public policy, had the opportunity to go join Governor Phil Murphy in his front office. I was one of his 4 lawyers. And within sort of the Department of Health, obviously the relaunching of the medical marijuana program in New Jersey, which is now sort of the 3rd most ambitious program in the nation. I sort of oversaw that program and absolutely fell in love with it. Did it for a year, and then decided to come back to McCarter to create a cannabis practice and continue to help medical cannabis providers in the state of New Jersey. We have a huge unmet population of patients in need, 200,000 right now. We're serving about 40% of that population, and that's a logistical problem more than anything else. So the governor just issued another RFP for 24 more dispensaries. That's the 4 vertically integrated dispensaries. Operators, which means they dispense and cultivate, and the rest for dispensaries.
What's the timeline before we see these?
So the RFP closed in August. We'll know by the end of the year, November, December, how many of the 196 applicants were selected. So 24 out of 196. But that will put the state in far better footing than it finds itself today.
What do you love about the industry? What's your passion for it?
I really see it as medicine. I see it truly as a disruptor against the traditional pharmaceutical companies. This really is a way to empower entrepreneurs on the one hand and provide much needed medicine at a very low cost on the other. So I really think it's a win-win for society.
Fantastic. Luigi, Dr. Luigi. I'm going to call you your proper title.
Please do. Can everyone hear me? Awesome.
Thank you.
So, 2 main motivations. One, personal, grew up with a family, Alzheimer's grandfather, Parkinson's uncle. I remember when I came to this country, in 2010, I promised my grandfather I'm gonna find a cure and fix your brain. And 9 years later, I didn't, but he's very proud of me that I became a doctor. I'm very grateful as an immigrant, as a 28-year-old immigrant that has lived the last decade in USA, of everything that this country has. So I think as a personal motivation, it's trying to give back to the American public what they deserve. I think America pays way too much in medicine. I think just because it's we see it as no disrespect to pharmaceutical companies, but I do see that this society, unlike Hispanic, Latin American, or even European societies where my father is from, it's a very drug dependent. It's a very quick pill, quick fix. And there's, we have a rise in technology. We gotta find a way of connecting the technology field with improving health. So when I started the PhD program, I really wanted to focus on concussion, on traumatic brain injury, because this is a disorder, and I don't want to overstate the case, but this is something that we just cannot diagnose, neither doctors or PAs or athletic trainers, physical therapists. This is just something you cannot completely diagnose, mainly because the two populations that suffer it, one is the athletes who lied on their tests before getting, so they don't lose their scholarships. So you cannot really trust this population. They always try to be under symptomatic. And then you have the military. With all respect to the military, they do the opposite. They try to exaggerate the symptoms whenever there's like something happening in Afghanistan, in Iraq. So you don't see a really honesty from the patient that had a concussion. You see patients exaggerating their symptoms. You see patients pretending they don't have any symptoms. So we need to use technology in order to find ways, biomarkers, objective, clear, practical diagnosis for this population. And concussion is extremely common. It is not just confusion and headaches and migraines. You can see these people in the subway using sunglasses at a Friday at 11 p.m. because there's just sensitivity issues. There's a lot of irritability. There's a lot of depression. There's a lot of anxiety. So we know too much about concussion, but we don't know how to fix it. So I found a link. I'm trying to use technology in trying to at least solve this issue, so at least this population wouldn't be, drug dependent and pharmaceutical dependent as American society I think it is. And just one personal anecdote, I don't know how many college students are here. 22 days ago, great, I was in college. You will suffer after you graduate what I call a millennial middle-age crisis of, oh my God, what do I do now? But then it gets so much better, so hang on there.
Quick question. How bad is the problem? How give us an idea of how bad this situation is.
The problem is so bad that I cannot tell you how bad is the problem. You have so much research on concussion, and there's not like a specific systematic review or literature review or even numbers from the CDC or government agencies. I mean, the CDC says that, last numbers, that after every person that suffers a traumatic brain injury, it's 50% of them is gonna suffer a second traumatic brain injury, and 10% are gonna suffer 5 or more. And this is a huge problem because it's gonna cause a permanent damage that you might not see it, you might not experience, but throughout life, it's associated with Alzheimer's, with Parkinson's, with chronic traumatic encephalopathy, with all sort of types of dementia that this aging population are suffering and that are causing a bargain in our healthcare system and in American taxpayer dollars. But that's the problem. We just cannot tell you for sure how bad it is.
Fantastic. Thank you. Marlin.
What's up, everybody? You guys falling asleep yet? No, I'm kidding. So my name is Marlin Jenkins. I am the founder and CEO of Netcher. So why did I start this? And I apologize. I told the guys this before. Every time I tell this story, I get a little emotional, so I apologize. There was a little girl, about 6 years old, who was going to the library. And the library was closing, and the little girl was crying to her mom because she couldn't finish her homework. And the reason why she couldn't finish is because the library was closing, and she was telling her mom, look, I can't finish. And the mom was saying to the daughter, honey, it's okay, don't worry about it, it'll be fine. The little girl had to explain to her mom, no, mom, it's not fine. I can finish, and there's nothing I can do. And she said, we'll do it at home. And the daughter said, no, we can't, because we don't have internet at home. And, excuse me, sorry, I'm a father, so this hits me. Every time I see that mom's face, it reminds me that it doesn't make a difference what happens to that child the mom, and it doesn't matter how hard she works and whatever she does, there's always going to be this feeling of failure. And that is why I started Nature. Sorry, it hits me every time.
No, thank you. You're working in the Bronx. You're working with a couple of hospitals, some clinics. Can you tell us how that's coming, what the challenges are?
So, if you know anything...
Actually, sorry, before that, maybe tell the audience quite how bad a problem it is in New York.
So in New York City, there's about a third of the households without internet access. So if you figure there's about 3.5 million households in New York City, close to 1 million have no internet access right now. The majority of those households are low-income families with children. And because of that, there are somewhere close to 50% of the children in our schools without internet access. So when you're talking about the gaps that exist, the reason why I'm here is because the gaps that exist in these communities are not just internet. Because if those gaps exist, there's also healthcare, finance, food, deserts, education is also an issue as well. So, my concept was, and when I started it, I just kind of theorized this, but then through different initiatives that I've launched over the years, I've realized that once you provide internet access, and if you're, I shouldn't say smart enough, but if you're thoughtful enough to then create a mechanism to create a pathway between those families and the different providers of those services, then you can achieve some difference, and that's what I've done.
So we're in Microsoft, the Microsoft HQ for New York, and Microsoft does fantastic technology for a huge variety of people. So you're saying a third of New York can't access these things?
Yeah, and that's based on the statistics that the city uses. I have a feeling it's a lot bigger, because what's typically used to measure access is if a family has a cell phone and or a computer. Obviously, I'm sure many of you understand this, but a cell phone, even though it can access the internet, is just a consumption device. It's not a creation device. So yes, they can access, but it doesn't mean they're going to be able to do anything really with it. So it's probably a higher number, but even if it isn't, 1 million households is 1 million households. That's probably somewhere around 3 to 4 million people. So if you're looking at, anything from education to government access to improved housing to better work, they're already at a standstill and getting further and further behind.
So we're going to do something a little different now. We're going to do some matchmaking. And again, the panel doesn't have a clue about this, but we've got 5 experts in different fields who are all trying to make a major difference. So let's just think about traumatic brain injury. Paul, what could be done, or can you do things that using hyperspectrum imaging in the brain, and would that help with traumatic brain injury?
So let me answer it this way. So I am actually aware of work that's being done with hyperspectral imaging on brain injury. But I think at the end of the day, while it's interesting, it's probably not a practical solution. Because the practical solution would be to have a test that you could do right on site. That you do off of a fingertip and you do it on site. And there are technology platforms now that allow you to do that. And increasingly, we're seeing many assays with many biomarkers moving in that particular direction. And I'm aware of at least 3 companies that are actually focused on this area, all trying to identify the right biomarkers that match the right sorts of changes. And I think that's going to be a really important contribution to how to manage these patients.
Thank you. Michael, what do you think? I mean, is this a sort of problem that Pfizer can get to using AI and different approaches?
For traumatic brain injury?
Yeah.
Oh, possibly. We actually had divested our whole neuro unit about a year ago just because we kept failing. We had Alzheimer's programs after Alzheimer's programs, and since we still don't understand what causes it, we can't really come up with a drug that solves it. So we basically, we didn't entirely give up. We created a venture fund that would fund research, but we decided that for us, the failure rate was too high, and we should just put our money somewhere else. So we kind of are going to let other people try to figure out that problem because it's very intractable.
Do you have an idea as to why it couldn't be solved? I mean, is it a data issue? Is it a technology issue? Is it just very, very hard?
It's a science issue that we don't really understand how the brain works. I mean, we have basic understanding that it's electrical signals and we know the anatomy, but the actual way it works and the pathologies that happen. I mean, even traumatic brain injury, we understand what it looks like, but what kind of drug would work to protect or permit recovery? I think until you have a solid understanding of the science, you can't really go that far. You're just kind of guessing. So you can throw things against it and see what works, and that's how a lot of drugs have been created historically. But from an investment perspective, it's kind of a lottery.
I was not going to bring up Viagra, but it did seem like the happy accident, which was worth a hell of a lot of money.
It did.
Now, obviously, that's not how you're doing things. That's not how you approach discoveries. But what is the Pfizer approach right now?
Oh, Viagra was I think it was for cardiac. It was a cardiac study, and the story was that they were giving out these drugs to men and women for the study, and men at the end of the study were supposed to give back the pills, and they weren't giving back the pills. So they're like, oh, it's weird. What are they doing with the pills? And so it's an interesting story. So they dug into it, and eventually somebody spoke up and said why they're keeping the pills, and then they looked into it. And it was a successful drug, and now it's generic, and you can get it over the counter in England also. It's pretty interesting, the progression of this whole drug. But I think that's definitely not our MO for drugs in general, despite the success. It was a complete happy accident. And
it was for pulmonary hypotension.
Pulmonary hypertension. Thank you. Hypotension, right. Thank you. So now, I mean, our strategy is just like most pharmaceutical companies, where we first figure out what areas we want to focus in. So neuro is no longer one of them, but we do focus on oncology, inflammation, cardiovascular, those areas, and then we decide where's the high unmet medical need, and then we find out where we think the science is and where there's a target to go after. So there has to be something that you can address with chemicals or a protein.
Now, you do worldwide testing, worldwide trials. Firstly, how diverse are your test subjects? Because it seems like an awful lot of drugs aren't tested equally on men and women, and diversity is still a big issue.
Yeah, I actually don't know much about that. I know we are not as widely spread as some other companies in terms of what countries we go after for clinical trials. I think the approval, certain countries required that you do a trial in that country to get approval. So any major country where we want to have an approved license, we would do a trial in that country. And from the men and women split, I don't know what the split is. I think it depends on the cancer. I think for an interesting story was the male breast cancer, Ibrance. We recently got approved for male breast cancer, and it's a rare enough form of cancer in men that we were not able to create a clinical trial to recruit enough men for that trial. So we use something called real-world evidence, where we basically look through all the medical records to see men who have taken this drug experimentally to see how the performance was on that versus other drugs or other treatment. And the FDA actually allowed us to get approved in male breast cancer without doing a formal clinical trial in live randomized study. So it's an example of not able to find that diversity, but still working with the FDA.
So the FDA taking a sensible approach. That's fantastic.
Yeah, and they're really becoming much more progressive in terms of reducing the amount of people you need for clinical trials and allowing us to use real-world data to actually get approval, and then payers are now paying for drugs based on outcomes. So you look and see how, in the real world, how well a drug works, and then the payer will decide if they're going to pay for that or not.
So I'm not going to ask you about weed or cannabis, but I'm actually going to, Guillermo, do you think this is the new Pfizer? Do you think this is the new drug revolution?
I hope Pfizer goes nowhere near it. But I do think it's an opportunity for mass adoption of a very effective medical treatment, full stop. The areas in which it can help are incredible. Every progressive state, every quarter it seems like, adds another ailment that medical cannabis can be prescribed for. Its effectiveness varies, obviously, from one particular area to another, but on the whole, incredibly effective.
So, not to be polemical or anything, and I have nothing against marijuana on a personal basis, but has it really been put through the same rigorous test as any other drug? Like a randomized control trial with a placebo and all the hurdles and the years of studies you have to prove that it's not just the placebo effect and that it doesn't have any off-target effects and there's no adverse events and all these things. So I get when you call it a medicine, but I feel like the bar for medicine is so much higher for prescription drugs than for natural products. It feels somewhat unfair.
I absolutely agree. And I was going to sort of piggyback on the FDA question earlier, right? This is an area that the nation recognizes needs to be addressed. I think we're seeing it right now with vaping, right? I don't think I've ever seen this much political agreement on any issue in a very long time. You have our dear POTUS like screaming from the hilltops down in D.C. to my Democratic governor in New Jersey, our Senate president, our Assembly Speaker. These are individuals who don't agree on almost anything, and they are all coming out pretty unanimously here against vaping. Now, I do think that we need some time here. I'm not sure if we should be outright banning anything just yet, but I think Senator Menendez calling for a moratorium until there's further sort of medical study conducted, I think is a fair idea, but there's a lot.
Would you say you're talking as a lawyer more than a medical
health professional?
Yeah.
Sure, yeah, no, I think we are inviting a ton of litigation. If there's an outright ban right now, there's some commerce clauses that both the federal government and the state government's gonna have to grapple with here. But look, you have these 6 deaths, vaping, similar to what the medical marijuana industry faces, right? It is easy to concoct your own version of medicine, right? These vaping, the 6 deaths, I mean, we're hearing reports here and there, no one knows for sure. These were all sort of personally concocted vape products, right? And a lot of the marijuana-related deaths that are surely still a great occurrence are oftentimes a product of some individual mixing, right? That strain with pick your fun other drug out there, leading to
We're getting
horrific
such
death.
a picture of what happens on a Friday night at MacArthur in English.
That's exactly right. Yep.
Luigi, you had a comment.
Yes. So I'm not gonna jump into World War III between Pfizer and the pharmaceuticals and marijuana company, or Iran versus Saudi Arabia. I do wanna say to just to respond to Mr. Frank that there's a specific reason just with neuroscience. There's a specific reason why we wouldn't put medical cannabis to the same rigorous phase 1, phase 2, phase 3 clinical trials of pharmaceutical companies just for brain injuries. And that's because 95%, and there's a new field that just came out called iPhone 10 X Plus. It's a neuro digestive system. So we now know that 95% of the neurotransmitters that we use in our brain are actually produced in our stomach. So it does make sense that when you treat nervous system disease, the more pills you take are actually suppressing the natural common functioning and physiology of your stomach. That wouldn't happen with non-pill marijuana. So there's a reason why, at least in the neuroscience perspective, at least for things for traumatic brain injury, I would be more inclined of coming up with not only technology, but natural resources, because the pills might do more harm to your stomach, to your digestive system, and consequently the neurotransmitters in your brain that marijuana or cannabis will ever do.
Thank you, counselor. I think we've got a job for you at MacArthur in English if you want to come make that case.
But again, that's just in the specific neuroscience perspective. You can go to cardiovascular, the renal, pulmonologist, and it's a different field.
Marlin, I'm going to go to you now.
Oh, that's all right. Keep going.
No. So, if people don't have access to information, they don't have access to good information. How are the third of New Yorkers who aren't connected, how are they able to get information? Is it just word of mouth if you're disconnected from information?
So are you asking me how do people who are currently connected access information? Is that what
No,
you're
no,
asking?
sorry. The people who are disconnected, what's the effect?
I mean, typically, if you think about it, most people, all right, so I'll give you, we just had this conversation with a hospital in the Bronx. The biggest issue that they have is that when someone is not connected to the internet and they have a health issue, they don't seek a doctor. They'll go directly to the emergency room, right? That's been a problem for decades. The biggest reason why someone is going to go to the emergency versus a doctor is not because they feel more comfortable going to the emergency room. It's because they don't understand that there's a different process, probably a better process to go to your regular doctor. Now, there is some fear to it. I'm not saying there's not any fear to it. Fear is absolutely a motivator to go to the emergency room, also because there's less likelihood you're going to be turned away. But if you can imagine for a second that most families, especially those who are low income, don't have the ability to research opportunities, options, right? Specifically something in healthcare. You know, there's a study that was done, I think it was like a year ago, that said that 85% of people that go to an emergency room research the cause of their ailment before they go. These families that I'm talking about, they cannot do that. So some of them will not go at all. Some of them will go, but they won't know exactly what they can't vet what the doctor's saying to them. And I hate to say this, but many of us, we try, I mean, if you're really good, you're going to challenge what the doctor's going to say to you because you don't want to just assume whatever someone is saying to you is correct. You have to make sure that you're addressing all of your ailments. Yeah, right? So, but these families will not. They'll accept whatever the doctor says and then go home and that's it. My mom's a perfect example. My mom's a recovering crack addict. And she was recently in the hospital. She had her hip surgery done. My mom does not have internet access. I had to go up there twice to talk to her to kind of walk her off the ledge. And one of the things we had a conversation about was, listen, Mom, you don't know what's going to happen if you leave this nursing home to go home because you just feel like going home and the impact it's going to have on your health care, your hip, so on and so forth. But she's going with her gut, which is what most families do. They're going to go with their gut. And because she didn't get an opportunity to research what she was going to do, and she didn't want to hear what I was saying to her at the time, she left, and now she's in pain. So it's that type of situation. All you can do is follow what you think you know.
So let's pivot on that. The next big question. Your president for the day. Please don't use Twitter. Your president for the day. You can make up laws. What are the things you change?
I mean, I think for me, you and I had this conversation earlier. The economy, as it's constructed today, is built on profit. Everything is profit-based, which means that we're not focusing on long-term investment. We're not focusing on sustainability. We're focusing more on, okay, how do I get my fix today? And I'm not worried about tomorrow or yesterday. So if I were president and I had the ability to do something along these lines, what I would do is I would find some way to reward sustainable progress and not focus so much on profit, on profit, on profit. And what I would hope is that by inspiring that type of a mindset, that we can invest more in communities and not focus so much on how quickly can we sell this house.
Are you thinking of the individual? Are you thinking of government or companies? Or all three?
I think all three. I think you can't teach sustainability on an individual basis or on a company basis or on a government basis and not have the buy-in of all three. So I think you have to look, my perspective is I don't want to be a billionaire. That's not my goal. My goal is to create 1,100,000 people, families, right? So, sorry. So if I can inspire more people to take care of their families better by having access to the resources to help them take care of their families, then I've done my job.
It's funny, it seems almost easy. So good luck, good luck. We'll be watching you. Right. President for the day.
If I was president of a country that I'm not even a citizen, I would.
Come on, babe.
No, absolutely. I have a really good. I would write an executive order demanding that at the local state, there's got to be free Wi-Fi and free internet access for all 330 million Americans and everybody living in this country. Because lack of information access, it's extremely not only correlated, but cause a lack of healthcare issues. Now, I'm not saying go and Google a symptom and trust Harvard.com or Harvard MD or Mayo Clinic, because it always says, well, if you have a symptom, you might have cancer and you might die in 24 hours. So that's not what I'm trying to say. There's a lot of .org, there's a lot of .edu websites that actually show really critical health information. But, and there's also a lot of YouTube videos for the millennial generation. There's a lot of TED Talks. There's a lot of interactive of people trying to explain one specific issue. I'm not a fan of Medicare for all or trickle down everything or yes, it's just universal basic healthcare, because it's not just how much it costs. There's got to be extremely 180 change in the way Americans perceive their health, okay? And it's not just lack of information, it's also everything that happens with the environment, everything that happens with the food that we eat, the extremely addition of chemicals and additives that are actually disrupting our things. I mean, it's crazy. I live in this country and I do exercise every day, and I gain weight. I went to Israel for 2 weeks in the summer, and I lost weight without any exercise, just because the food is healthier. Everything you eat, so in America, it's either a burrito inside of an ice cream, inside of a Dorito, like. So, and on a serious note, the two main issues that I see, because we cannot blame everything to the doctor, and we cannot blame everything to the patient, and we cannot say, oh, the government just sucks. There's two main issues. Health illiteracy, people just don't know about health, they just don't know about science. And there's also science communication. The medical doctors, the researchers do a very lousy job sometimes in breaking down the information. So you have a patient and you have a doctor speaking two completely different languages. So as a president, I will try to at least expand the access of health and internet information for all citizens.
Fantastic. I think we have a new president. Guillermo.
You got my vote, buddy. So I hate this question because I've spent a good amount of time in government, and every time I've said yes to whatever governor or senator I went and worked for, right, in the back of my mind, I was like, well, I'm doing this because I want to make X better, right? And then you get in government and you realize how damn hard it is to get anything done. So, we could sit here and...
This sounds like the dude... It's the Big Lebowski defense.
Yeah, well, I mean, it's the truth, though. It's really, really hard. I'll stay with my sort of topic here. I think just a simple expansion, right? Affording more individuals, right, the training to run a dispensary, to be a grower, right, in the medical marijuana space, I think will go a long way in providing more medicine for more people. So I think education is the key there, as it is in most areas. We have no undergraduate or graduate degrees in this area. It's mostly farmers who at some point decided to go into this space, just like they were cultivating anything else. You have your science-y folks who have like a natural inclination towards growing. You have the biosynthesis world right now, right, where they're trying to address the issue of purity, right, in the cannabis industry. To Mike's point earlier, right, one of the problems is finding the consistency, right, producing the same product over and over again. And the greatest operators still fail in this area. So I think putting more money into that area would be very beneficial.
What's the reason that cannabis is not legal? Is it the tobacco companies lobbying against?
Yeah, I think it's just a lot of outdated sort of perceptions of the drug. You have so in New Jersey, for example, the no votes, so I'm gonna mess this up, but it's about 60% of the no votes came from legislators who were 65 or older in New Jersey. And we have a lot of them who are that age. And so a lot of it was that. And no amount of educating them, and the industry has tried pretty much everything, can convince them of the true positive attributes of medical marijuana.
Paul, what would you do? Unlimited power. Go crazy.
Well, I will say, Marlon and I were talking about this earlier, and I really support what he was saying, because one of the things we've seen, which has really been challenging over time, has been this shorter term focus on investment, and you're talking to somebody who started out sort of trying to develop new products, ended up being a CEO of a public company. So I went through all the pain of this kind of thing. But what I found is that the world has changed very dramatically. And the opportunities to fund early stage companies, it's just not the same, because the expectation is for turnaround and profit very, very quickly. Everywhere you go, revenues within a year, where was it? Maybe 2 years. And I don't know how you fix that, but I think it's a stunning difference from when I started out, with Kleiner investing in a company of ours years ago. It's just not the same anymore. So
Would you change up a tax structure or an incentive, or
I
is it just
certainly,
an approach?
if there are ways to do it, I would, to sort of motivate that. I think what I've been told is that the limited partners have changed over time. And so they're more like public company investors than they were in folks who were sort of focused on longer term kinds of products. I will tell you, when you go out and talk about near-term, long-term companies where you have to develop a technology, I hear quite often you should go out and talk to the Chinese. The Chinese investors are there to do that kind of thing. So I think that's a really big issue.
Actually, that's probably a perfect place to move on to Michael. Michael, Pfizer it's incredible spending. It's the cost to develop a drug is amazing, and yet Pfizer is doing it. Do you think this is a sustainable model?
I don't think it's totally sustainable, and I think if anybody watched, just on the theme of presidents, the Democratic debate, there was a lot of talk about the cost of prescription drugs and the brokenness of the healthcare system, and I think it's very true. I think prescription drugs, first of all, are about 10% of the total healthcare cost. So I think, yes, that system is broken, but there's even a bigger problem, which is the entire healthcare system is still broken. So you shouldn't single out the one aspect that's innovating and creating new, directly creating new cures as the one place that you should go after. I think you should go after in a totality, fixing the entire healthcare system first. So understand why we spend twice as much on healthcare as our next industrialized country, with the outcomes that are still, in most measurable ways, whether it's birth rate, lifespan, health span, still below the EU and Canada.
It's the very lowest.
And I might add to that, the debate doesn't talk about outcomes. I keep waiting for somebody to talk about outcomes, but they don't.
It's hard.
I don't know. So you're president. What? You can change anything. What would you change?
Right. I'd first pardon a couple guys from high school. I know I would not get involved in weather prediction or hurricane prediction for sure.
I want to know this story.
No, I can't talk about it. It probably would be myself, if anybody. No, I think I would focus on fixing the healthcare system. I think Obama did a great job in finally making motions towards a more normalized healthcare system, a more modern healthcare system where you don't have pre-existing conditions. I think Medicare for all should be available. I don't know if it needs to be mandatory per se, and I think this is where you get the split across the Democratic candidates and how far to push it. But I think the idea of having an option for every single person in America to get some kind of affordable healthcare and affordable prescription drug coverage would make a lot of sense. And there's nothing impossible about it. Every other country is able to do it, so it's not like it's a moonshot per se, like curing cancer. It's just getting organized.
Thank you. That's fantastically counterintuitive, but I'm glad you said it. And then the third big question, and unfortunately we're running late on time, but the future. What is the thing you're most excited about? I mean, we're in an age of very big data. AI is starting to be used quite well. What's the thing or company that makes you most excited? Actually, inside Pfizer, what do you go, this is brilliant?
I think gene therapy for me is fascinating. That this idea that you can now take CRISPR, gene editing, and some kind of vector like a lentivirus, package that up, and basically cure, in theory, cure any disease that has a single single genetic component to it. I think there's just a limitless, well, there's 20,000 or so diseases that are based on genetic disorders, and the idea that you may be able to cure a large percentage of those if you spend enough time and money on that is just mind-blowing.
Paul, and please give a good pitch for what you're doing. It's great.
So I think this is a pretty interesting time for things coming together. So you're talking to a guy who's been chasing biomarkers his entire life and figuring out what do you do with them. And there are a few things that are coming together. Obviously, there is what's happening on the information side, the actually aggregation of data. The electronic medical record may be a hassle and lots of things, but we're getting information out of that we've never had before. The introduction of AI. Actually, I ran a company back in the early 2000s that used neural nets for making diagnosis in pap smears.
You were early. You were early.
Yeah.
That's great.
So the best part of the story is that we had two groups of engineers working on this. There were guys who were grew up in the U.S., who had developed neural nets for the Navy, U.S. Navy. Then we had a group of refugees, Jewish refugees from Russia, who did the same thing for the Soviet Navy.
Of course.
So we had two groups working on this product. And
Your mic is not working.
anyway, so that was a critical part of sort of so this coming together now, that opportunity. Second is biomarkers and the ability now to look at a variety of proteins, DNA, RNA, and to use tools like CRISPR and others to create new
Does feel like
biomarkers to identify.
it's all coming together.
It is. And then
Yeah.
there are models like organoids that allow you to test those out. And then the final part of it is capture. We have circulating DNA we can capture now. There are circulating tumor cells, even with things like hyperspectral imaging where you can do it through the skin. So those pieces are all sort of coming together now that will create, I think, a real change in how we do things.
Fantastic. Guillermo, do you want to talk about some of the companies or approaches you're leveraging?
We won't name any one company, but biosynthesis, right? Cell agriculture, I think, is the most sort of exciting area within cannabis right now. I mentioned sort of earlier, it's sort of countering some of the attacks that the industry faces, right? And finding sort of strain purity. Biosynthesis produces a 99% sort of foolproof product, right? So there's a 99% chance that the THC content or the CBD content in that X is in fact there. So I think the more you see that, the less plant-based production we're going to see, the safer the product, the greater the application.
Thank you. Luigi, what is the thing you're working on right now which is most exciting and people in the room can help you with?
People in the room can help me with.
Yeah.
Well,
you've got a room. Let's get some.
Everything I tell
Get
you,
some talent.
please feel free to always fact check it. And at the same time, once you find out that what I said was true, go and actually expand information. Look, there are three things. My field, traumatic brain injury, and you separate it in mild traumatic brain injury, concussion, then moderate, they have the injury, and then severe traumatic brain injury, people that are in coma, vegetative state, 18 years. I'm very optimistic and I'm very excited of the things that are happening in the technology level to help them. So 2010, traumatic brain injury, severe, people in coma. There was Dr. Schiff in Cornell found a way, deep brain stimulation to a patient that has been in coma for 10 years and everybody lost their hope. They opened their brain and put a deep brain stimulation. This person woke up and was able to do things. That was in the severe side. In the moderate side, we would like some FDA help for this, but there's techniques that are electricity and magnetism because that's who we are, the nervous system. We're just electricity communication. But there are things like transcranial electric stimulation, transcranial magnetic stimulation, and the same for the spine. There are tools that we're using, that scientists are using to try to make what we thought was an injured part of your brain or of your spinal cord to start functioning. And at the concussion level, we are coming up with new techniques, or at least my research, to just not look at the brain, but look at other parts, such as your heart, your EKG, which it's an indirect way of measuring what we call the fight or flight system. Have you heard about it? We call it the autonomic nervous system. I think about it as automatic because it's something that you can't control. And wouldn't it be amazing if instead of having a concussion, seeing 5 doctors, fighting with 10 administrative assistants of insurance, get one electrode on your heart and being able to detect if you're actually, there's a correlation between your symptoms, the way your brain is activated, and your heart, and also your muscles. So I'm very, very excited. I would like to achieve progress in both technology and information of the people. And lastly, I would really like I call it the Californicated companies, the companies in California that are very good at blocking ads from Tulsi Gabbard when she did really good at the debate. I'll be very happy if, when you have Facebook, Twitter, Instagram, of any social media, instead of just seeing, an ad selling a perfume from Dior that I'm not ever gonna buy, if they, put information about quick tips of how to improve your health, or like top 3 things you can eat, or maybe you shouldn't eat this too much, or maybe late at night, okay? I would like to see, for the people that are driving data and information, a real push, a motivation, a drive to actually help their country and the people that are paying taxes for them.
Fantastic, thank you. And lastly, and certainly not least, Marlin, and you're rounding up the panel.
So I'm actually in a very, I guess, from my envious position, because the work that I do has impact every single day. So I can kind of address some of the things that everyone's talked about. We have a platform that we designed that will connect families to the local resources in their community, and it's a very localized system. And one of the things that we did this for is because we realized that the families, as I mentioned earlier, once they're disconnected, they don't have an ability to know where to go to get some of these resources. So when we did our beta test a couple of years ago, one of the things we found is that we had there was a mother who she had her son, and she was going to college, and we gave her a free computer that was donated by a local nonprofit. We gave her internet access for free for 2 years. And in that process, she got her her master's. She got a better job. Her son did better in school. She was connected to a local government. She signed up for Medicaid for all these different things in the period of time. So her life has changed. She's not in the complex that she was in when he gave the service to her. So we realized early on that once you have these tools established, you can start to connect people to the resources that they didn't realize they even knew they needed, and then you can start to solve the problems that you thought weren't previously unsolvable. So that's what I'm happy for. That's what I'm looking forward to.
Fantastic. Well, thank you so much. If you could add a round of applause for the panel. And I think we've seen the future of healthcare and wellness in many different ways. So, time for questions. We have 10 minutes of questions. Put your hand up, and please make sure your question is in the form of a question, not a long statement. So let's keep them short, keep them snappy, and if you want to direct to a certain person, we'll do that. Yes, at the back. Do we have mics running around?
Oh my God, I can run it around.
Thank you, Sept.
This one, the quiet one? They all like Q question?
Oh, we had one at the back.
Here's one.
Blue suit.
Can you hear me?
Oh, sorry, at the front.
So, I believe it was like 5 or so years ago, I was reading about biological 3D printers. And at that time, they were saying that they were able to like produce skin using your genetic codes, just like your own skin. They could do that. Then year later, I was reading about they were able to build your ear,
cartilage,
entire
yeah.
ear. And they were saying that within like 5 or so years, they'll be able to perfect that technology to build anything. Any update on that?
That for me, yeah, I think I remember seeing the same thing with the ear on the back of a mouse, and the 3D printing was more about just taking cells and stacking cells to create a structure. And there's still a lot of activity in that space. I don't think it's become as ubiquitous as regular 3D printing. I think that at some point they kind of came out at the same time, and maybe there's some hope that it would be like in everybody's home, there'd be 3D printing replacements. But it's used in research. I mean, you were talking about organoids, and which are basically just small functional clumps of cells that can act like an organ and they use them a lot for experimentation. So studies are moving more and more away from animal research where they can and using small organoids. But I think as far as creating superstructures, it still seems like it's just in the kind of startup companies and experimental stage. I don't think anybody, as far as I know, there's no major commercial products yet.
Yeah, there's a few things in China, but not much. Although I wanted that mouse. Yeah. Another question.
So,
yes, on the side.
so my question is with the recent cellular therapies like CAR T, et cetera, some of these treatments are one dose can cost in excess of $2 million. So just curious to see, I mean, if we want to try to cover more widespread treatment at a $2 million a pop, how do we fund that? And then do we have the right to turn around and say to certain people, well, you've been a chain smoker your whole life, so we're going to be able to sort of maybe not necessarily take care of you, whereas somebody else who was healthier or didn't abuse their body would potentially, I mean, just when you look at public funding, curious to see what your thoughts are and how that can be approached.
Michael, I think that's you.
Is that for me?
I think so.
So I think there's two questions in that. There's two parts of that question. One is the price of cell therapy, and then two is this idea of kind of a moral judgment of who should get therapy. And I think I don't think I can comment on the second one because that's more of a governmental question. But on the first question, CAR T, it's actually not 2 million. That's probably gene therapy, I think is what you're thinking of. CAR T is more in the couple 100,000 price range, maybe $500,000 at the most, depending on the company. Only a couple 100,000. And the reason it's so expensive is because right now you have to take out your blood cell, your white blood cells with leukapheresis, and you have to genetically engineer them, and then you have to put them back in. You have to grow them up, then put them back in. So it's a very complicated sterile process that's hard to mass produce. It's basically this crazy hospital system. So that's where a lot of the cost is basically figuring out the hospital system. So I'm sure it will go down. I think I know companies are working on a system where instead of having to take out your own blood cells, process them, and put it back in, there's something called off-the-shelf CAR T. There's a bunch of companies that are working on that. Pfizer was working on that, and we kind of divested that to a separate company. And that will presumably be cheaper because it's off the shelf. But I don't know if somebody else wants to comment on the healthcare system.
Actually, a quick follow-up on that. What was the original cost of sequencing a DNA panel for the human? Was it $2 billion? And it's $100 now? Do you think we're on the same trajectory?
Sure. Yeah, sure. I think for all these, I mean, it's basically you're not paying for. It's like software in Microsoft. Like you're not paying for the raw materials. You're paying for the R&D and for the failed products as well. And so some of the cost is just going to be baked into the research, and it's not the actual raw materials that you're paying for. Just like a CD of Windows, you're not paying for the CD. You're paying for the intellectual property. But I think in certain things kind of plateau. Like if you look at the price to manufacture a small molecule, which is like a chemical drug, versus a large molecule, which is like a monoclonal antibody, those used to be like that's what the biotechs used to create, and those were always expensive and new. But now, I think when you look at the internal costs, they actually cost about the same amount of money for a company. So these crazy large molecule drugs that are created from biological processes are now, from a cost of goods perspective, basically on parity with just chemical reactions. So I guess in some sense they will probably get cheaper.
And just to comment on the second question on the moral real quick, this probably didn't hit the news, but last year the government did pass a law. It was called the Right to Try. It was pushed by Vice President Mike Pence, and then it was really called out by Donald Trump in the State of the Union back in January, that this law actually answers the question of anybody who is in a critical condition, regardless of their background, have a chance to be able to be admitted in all clinical trials. So from the first-hand smoker, from the second-hand smoker, to the person who just developed a chronic condition based on genetics. So that takes away the moral aspect of it.
Fantastic. Last question of the evening. Let's make it a good one. Can we have the guy at the back?
Hello, is this working? Can you guys hear me? Jaden Sage here. By the way, side note, if you, going back to 3D printing, if you remember they had kidneys that were being printed, all that. I funded a company that was providing the equipment to do that 3D printing to Wake Forest. So if you guys want to know about that and any updates, you can ask me later. But going back to the dilemmas that we face today, the healthcare industry is fragmented between the patient, the doctor, information, data, and technology. And sitting in between all of that is a profit quotient. And that profit quotient operates in a way that limits, or the profit motive limits, the desire to have disruption in the innate systems that are in place. How would you guys think that we can provide a better balance to that outsized motivation? And as a clear example, you could have a $2 antibiotic solve a problem that they are pushing an $8 drug for in order to accomplish the same goal. But then there's also ingrained people.
Okay, thank you. What do you think? How do we upend the market we have at the moment?
I cannot completely answer the question. I will say, though, that a lot of the new drug discoveries are happening based on mechanisms and genetical and neurological findings that we're finding at the universities. This university research is funded by taxpayer money, by public funding. So I think the main problem right now is that there's a lot of companies that are selling drugs that are using those drugs, because there's no such thing as a self-made Nobel Prize winner. You know, science builds upon existing science. So I think the very injustice is just that a lot of the companies, whether insurance or whether they're hospital administrations, whether they're the other companies that sell cheaper drugs to our neighbors but not to us, are using data and information that was done by the public, that was funded by the taxpayer money in universities, in PhD students that sacrifice a lot of their weekends dealing with rats, dealing with mice, to find that discovery. I wouldn't say, you know, and I want to try to give a positive mentality. I wouldn't just blame everything to greed and to just, you know, there's, oh, the CEO of this company makes too much money and that's why everybody, you know, has cancer. It's a very multidimensional, multivariable, complex system, and you see it in the food that we take, in the air that we breathe, in the lack of knowledge of the people. If you, focusing on just greed or something, it's not healthy for the civic discourse, for the public interactions, and honestly, it wouldn't drive things much farther than addressing all other parts.
Wait a minute. So what I will say to you is, I think one of the true ways we can probably start to upend the system is by focusing on areas that are not typically serviced today, right? So if you think about the way Facebook started, and it's a bad example, but it's just to give you an idea of what I'm talking about. So Facebook, when they first started, they focused on college students, right? And that's all they cared about. And they found an quote unquote untapped market by focusing on that market, and then you expand from there. So if you look at like what I'm trying to do, and again, I had this conversation earlier, there is a huge untapped market if you look at low-income families. Now, I know that low-income families, when I talk to the average investor, they say, why are you targeting that demographic? And the reason why I say is because there's way more of them than everybody else, right? So if you solve a problem there and you don't focus on, and this is an individual business perspective, mind you, this is not something that can be adopted to everybody. I know it can't. It's kind of like the president question earlier. But if I, as a business owner, decide not to be focused so much on profit and focus more on the sustainable investment in that community on a community-by-community basis, maybe I can find a solution that most profit companies are not going to think of, build it from there and grow it, and then hopefully that has an impact in a way that it wouldn't ordinarily. And that's the only way I could think of it, because I don't know if there's any, you're right, the system's already designed. It's already predetermined it's going to work a certain way. So the only way it's not going to work that way is if you focus on areas where most people don't really care about, build it, and by the time they focus on it, it's already built and it's already designed, it's already having an impact, and then you go from there. That's the only thing I could think of.
Thank you so much. And thank you to the panel. Well, do stay around. We have 4 very interesting speakers coming up. We have a fireside chat, and we're going to swap out, and Bruce will take the lead. So thank you again.
There's still lots of food over there. Also, the fireside chat is going to be much more relaxed. We're not going to film it. You can just